Hi, my name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in sports medicine and complex knee injuries. I see a lot of patients who come to see us for joint preservation. And what does that mean? Well, it means that they're having persistent pain in their knee and they're trying a significant amount of conservative treatment, and they've been told by somebody else that they need a potential knee replacement or partial knee replacement or another cortisone injection. And what the patient actually wants is someone to help them save their joint, help them stay functioning at a high level or a level that they're used to without pain. Joint preservation can be somewhat comprehensive in that sense, but many times surgeons and doctors are sort of fine-tuned as to specific types of treatments that they can offer. In recent years, there's been a growing interest in saving the meniscus root. What does that mean? The medial meniscus is the cushion on the inside of the knee, and on the back of the meniscus, there's something called a root where that attaches into the back of the tibia. There's also a root in the front of the meniscus, but it's typically the back one or the posterior root that is the one that's disrupted or torn. That can lead to arthritis or, unfortunately, a short period of time in many patients, and can lead to a bit of a crippling condition to a patient's knee. Many times those patients come to see us after second or third opinions or after an initial failure of conservative treatment, and so time has elapsed, sometimes 3 months, sometimes 6 months, sometimes more. We've recently developed a technique to address some of those more chronic root tears. We have a triple-pronged approach at addressing these patients in the sense that we repair the medial meniscus root. We provide a additional stabilization. It's called a centralization stitch to bring the meniscus back into the joint, as well as addressing the cartilage or the articular cartilage damage that occurs after a root has been torn for an extended period of time. This essentially is early arthritis, and with the Cartiheal Agility implant, we are able to actually restore some of the articular cartilage surface that has been damaged by not having the functioning medial meniscus in place. So we're really able to save the entire medial compartment of the knee through one single stage surgery, one recovery, and help avoid and minimize the need for a partial or total knee replacement. Moreover, we're able to get that patient back to the level of function that they were previously used to before they had knee issues. This is all done in a biologically friendly way to give patients their knee back and not feel the need for a partial or total knee replacement or any sort of surgery that really doesn't have a turnaround or reversal. So we're excited about using this approach in these patients that typically would have no other choice other than arthroplasty. If you're interested in hearing about more, please review some of our other videos or our website or come in for a consultation. Thanks.